Hello, everyone, and welcome to another episode of the Overcoming Chronic Illness podcast. My name is Dr. Brian Rade, and I'm a naturopathic doctor. And today I am joined by my colleague and good friend, Dr. Rochelle Wilcox. Dr. Wilcox is a fellow naturopathic doctor, and we've been working together for the last 10 years or so. Rochelle, while she doesn't specialize in complex chronic illness per se, she's treated a number of patients over the years with Lyme, chronic infections, mold illness, mast cell activation syndrome, heavy metal accumulation, et cetera, et cetera. And she also does a lot of mind, body, mental, emotional level work with her patients as well. She works with a number of different therapies that I don't work with a whole lot of in practice. And I thought she'd be the perfect guest to have on the podcast because I think she will bring a unique perspective because she's familiar with the wild, wacky world of complex chronic illness, but isn't, sort of heavily steeped in it and works with other therapies as well. And I'm just really curious to pick her brain and see, what kind of support she can bring to folks who are suffering from conditions that have complex chronic illness, but of course, folks who are getting well, as they're progressing along their path towards wellness, putting the symptoms and causes of complex chronic illness behind them as they start to kind of phase into being more like sort of typical patients, not complex chronic illness patients, then of course some of the therapies and interventions and things like that that might apply to, say this, the general patient population can become, more applicable and relevant to them as well. So I think that there'll be, a little something for everyone in this chat is my suspicion. And then also just from a completely selfish perspective, I just never get to chat with Dr. Wilcox as much as I'd like to. We're both really busy. We've been working at the same clinic for a long time, but there's very few spare minutes to chat and whatnot because we're just seeing patients or rushing off to get home to our kids or other, commitments or whatnot. So I'm going to pause the recording here for just a second, and I'll be back in just one moment with Dr. Wilcox. All right, everyone. So I'm now joined by Dr. Wilcox. Dr. Wilcox, thanks so much for joining me today. It's really great to have a chance to chat with you.
Always.
I was saying in the intro, we like never have enough time to chat. We've been working together. I was saying for about 10 years. Does that sound about right? And just the number of times we've, had lunch together or spent time for more than like 5 seconds in the hallway saying hi, like it's probably can count that on about two hands over the 10 years because we're just so busy running around all the time. But
It's a little bit sad, but yeah, it's true.
it's a little sad. But we do see each other sometimes, outside of work and stuff. So it's like at our belated Christmas party last night. So that was, anyways, we still, we still connect from time to time. Anyways, it's nice to be able to chat with you. Would you mind just sharing with listeners just a little bit about yourself, maybe why you got involved with naturopathic medicine in the first place, maybe kind of what the nature of your practice is like, and maybe just touching a little bit on what your experience has been like, or what kind of conditions you've treated that kind of fall into that realm of complex chronic illness, please.
Yeah, for sure. I originally, whenever somebody asked me this question, how I got into naturopathic medicine, I'm like, it kind of starts with a little bit of a heavy story. I was 20 and my brother actually got testicular cancer. And so I was living in Europe at the time and really kind of just dug in. I was going to the library. I was there for fun and travel. And I ended up just spending all my time in the library researching and being like, what can I do for him? And ended up coming home and I graduated from St. Mary's with international development studies. So totally not like science related at all, not thinking, that I would go down this medical route at all. And then, lo and behold, my brother gets sick. It just totally shifts my trajectory. And I ended up studying nutrition. And then I realized with that, I was like, okay, this is great. And this is obviously extremely valuable and the foundation of most things, but it wasn't enough. It just felt like, okay, like what else is there? And my brother, by the way, is great and healthy and lovely now. But it really sort of sent me down this trajectory of medicine and health and what it meant to be healthy. So when I eventually wound up in naturopathic medicine school, I thought, okay, this is great because this is nutrition and so much more. In fourth year, I did my a specialty shift in cancer. So when I first started practicing, I really kind of focused on cancer. And I did that for about 3 years, and it was really rather heavy. So I sort of changed, expanded my practice, and yeah, shifted away from that a lot. And so now, in terms of what I see, who we see at the clinic, I think I've been practicing now for about 13 years, I think. 13 years, 14 years. I'm in my 14th year. And just that trajectory, I didn't initially, it was like, okay, I'm doing this out of this drive, to help my brother and people like this, and really watching it unfold over, this decade of seeing, okay, that's happening. And then seeing, okay, you're treating a lot of stress, digestive issues, sleep, like just a general practice is what I have. But also looking at how people are coming in more and more. It feels that more and more people are coming in with this stress of just lifestyle and how everything is like impacting that on every level. And it just feels like it's more and more that's happening, or just maybe my awareness to that is just greater over the years, and seeing it's like, okay, at first, with naturopathic medicine, we have a lot of tools to help with stress, whether it's from an illness or from a loved one, being sick or an accident, or, whatever the stress is in your life. And then my practice sort of expanded. That's where I sort of got into the mental emotional, because just, could see that herbs were extremely helpful and lifestyle changes were very helpful. But what else could we, do to really make change for people in their lives and in their health? And so it's really kind of changed over the years, and it's actually been beautiful really to look back and see, okay, like how the, medicine, looking at it from this individual perspective, and now really the last couple of years it's been more I want to say global. It's been global, but it's also been more like community oriented, and exploring that part of medicine is really something over the last few years that's really fueled me, and still really fuels me. It's a big passion in terms of, starting to do group work and things like that, to really bring in more people to support our health, and our vitality. So I'm not sure if I answered your question really, but that's, yeah.
Those are all good, very useful
Yeah.
words to string together, Dr.
Yeah.
Wilcox. And yeah, it definitely touched on what I was gunning for there. So thank you for sharing that. And it's such a, it's a great thing to say just for, or a great point to bring up for just, anyone for their general health, like, around the stress aspects of things. Or I know we were chatting the other day, about how if there's just a lot of stressful burdens on a person's nervous system, like their ability to regulate their basic autonomic nervous system function is going to be compromised if there's too much stress or there's not enough stress, sort of coping mechanisms or whatnot. And that can have an impact, that does have an impact on anybody's health. But so many of my guests who are just 100% like specializing in complex chronic illness, I'd say a majority of them now are just, at some point in our conversation mentioning like, yeah, working on the patient's nervous system is so important, like whether that's amygdala retraining or, as you know, and some listeners know, like I'm now kind of obsessed with brain mapping and neurofeedback. And like several of my guests have been talking about how that's been really crucially important, or, somatic experiencing, or maybe we'll talk a little bit about family constellation therapy. I think I had one patient who talked about family constellation therapy, but you'll be like the most targeted person talking about that, maybe if you're okay to go there. You're a big part of what you do. Um, and so excuse me, I think that it's just a really relevant topic for anyone, but especially majority of folks listening are going to be listening because they are suffering from complex chronic illness, or maybe have a loved one who are suffering from complex chronic illness. So it's just a really relevant thing to mention. So I guess on that note, since we're kind of going down that pathway, I'd like to talk to you or ask you about family constellation therapy and other things that you find outside of maybe we can talk about supplements and herbs and things like that, as well as non-supplemental interventions that you found to be helpful for nervous system support. Just before I ask you about that, Dr. Wilcox, I'll just quickly mention that, as per usual, nothing that is said during any of these interviews, including this one, is intended as medical advice. It's for informational purposes only. And if anyone listening needs medical advice, please talk to your healthcare provider to get that advice. So, Rochelle, could you riff on, what kind of things do you do to support the patient's nervous system, please?
Mm-hmm. Yes. Ooh, so many things. So from you mentioned family constellation therapy, which I can chat about first. That's been something that I've been doing for the past 4 years now, doing one-on-one with people and then also group work. Um, Family constellation therapy is something that originated in Germany. It's been around for a long time, and it's a way of I think when it comes to, whether it's complex chronic illness, stress, whatever in our life, with the demand, the load that we're carrying, family constellation work is a way of looking at you're not just isolated. And I think just really fully embodying that somatically and knowing, okay, like I'm actually not alone. Constellation work is a way of bringing your awareness to where you've come from and your ancestors. And a lot of what we carry and who we are, is from our ancestors. A common study that many people may know of is the studies that they've done on rats and mice, where they've rung a bell and then they shock the rat, and so they've done that numerous times, and then after a while they'll just ring the bell and the rat will act as if it's shocked, without shocking it, and then they bred those rats, and then the previous 2 generations, I believe, afterwards, they never once shocked them, but they would ring the bell and they would act as if they had been shocked. So, just this idea that we really do carry so much weight of our ancestors, and so um, the with family constellation work, it's a way of really bringing that in and honing that into our body, that we know that we're coming from our ancestors, and that it allows. I see in a lot of people that do this work, whether again in one-on-one or group work, I've seen a lot of people that do it, uh, a very like a very big shift in their nervous system during, usually during the workshop. And it really provides, when you're doing it in a group setting, you're actually, it's very unique because you're actually looking at something that's happening in front of you. And the piece about this work that I love so much is that it really allows for you to have a different perception. And when you can switch your perception or your reality a bit to your history, maybe to a relationship with your mom or your father. A lot of people, for an example, I had a woman that came in with chronic pain, really, really bad right shoulder pain, but just all through her body. And she had tried all these different things. And so she came and she wanted to do this work. And so we did a constellation on that. And she didn't know her father or her father's side of the family at all. And what ended up showing up was that this pain was from her father's father. And it really like shifted a lot of things for her. She didn't even really bring her awareness to her father, like her grandfather that she never knew. So even just that, realizing there's a whole half of her, 50% of her, that she hasn't even really explored. And when we started to explore that, her pain started to lessen over time. And it was a really beautiful example, and many examples of that. With constellation work, you can do it for relationships. You can also do it for, illnesses. And so I've been doing it for illnesses, and seeing shifts in people that, when they're realizing sometimes we're actually carrying pain, which sounds like a funny thing, carrying pain from your grandfather or your father. Okay, that seems kind of silly, but there really is this blind love that also kind of comes through with these with our family. And we can have these kind of entanglements that are there, that once you are aware of it, really all that work is doing is bringing awareness to it. And that awareness allows for that perception change, which often like clicks something in people. It's like, oh, aha, you have that aha moment. And then, life changes. There's a shift there that really changes for people. So, excuse me. Yeah, that's one thing that I absolutely love, and have just been digging my heels more and more into. I'm just fascinated by that work. Hmm.
So I have a couple of follow-up questions for you on all of that. So just as you're talking at the end there about the family constellation therapy, I know that from my understanding of family constellation therapy, it's not lumped into the same category as, say, trauma informed therapy, but um, based on what you just said, it sounds like there's maybe some significant overlap there. And I'm just wondering if you've thought about it from that perspective, or if you could just speak to like, do you see any overlaps there at all with trauma informed therapy and family constellation therapy?
Definitely. I think, just to, there's a lot of facilitators out there that are doing family constellations. It's also known as systemic constellations in a variety of ways. And sometimes it ends up just being, sitting there with a client that you don't even end up doing a constellation. You just end up talking and almost like somatic experiencing, just kind of witnessing and allowing some awareness to happen. And sometimes that's all that happens, very much so. So somatic work, somatic experiencing, trauma informed, it's all very much a part of it. I think with constellation work, it's one of the things that I love about it is that it's so flexible and dynamic, and there's no boundaries as to where you can go with it. Yeah, so sometimes sometimes I'll just be sitting there and the conversation will come out and the client will just have, when we're doing the work, we're slowing down the nervous system immediately. And so as soon as you do that, for a lot of people that aren't used to doing that, it can just, already click in things for people, and people can just start emoting, within a minute of realizing something, or talking about something in a group in front of people, right? It takes a certain amount of courage and vulnerability to be able to do that. And just that, the witnessing, I think, is very healing for people.
That makes sense. Yeah. And where I have some experience with family constellation therapy, like I've done a little bit of one-on-one work with my own patients over time. I've been part of a couple of constellations at Dr. Klinghardt workshops many years ago with my wife and I. We went, and it was great. But in my experience, much more limited experience than your experience with it. But um, I would, if I was to characterize sort of the family constellation experience, I would say that it's definitely like it's very, very profound. And there can be like elements that are kind of like acutely, like for short periods of time, intense, but generally, like I kind of feel like it has almost like this almost paradoxical kind of gentleness to it in a way where like it's just kind of a very like it just has like a certain flow to it where it's just this like natural unfolding of releasing of emotions or integrating certain things. And so yeah, kind of this interesting juxtaposition of like incredibly profound, sometimes intense in the moment, but it's not like, oh my gosh, like I had my family constellation therapy session and like my world was just kind of like rattled for the next like 3 to 6 weeks afterwards. And I'm wondering if you've had similar experience or how you'd characterize that.
Yeah. Um, well, it's interesting. There's a facilitator down in San Diego who describes constellation work as in there's sort of this pyramid, and constellation work falls like a bit higher on. It's almost like if you think of Maslow's hierarchy of needs, you need to have your survival needs met first before you start, expanding into other realms. And she created this pyramid. Emily Waymire is her name, and she created this pyramid where somatic experiencing and working in the body is actually very important and almost key to do at least a little bit of that before you really drop into some of the family constellation work. And I've been, resonating with that and thinking about that a little bit more, where it is very soft. And the piece about that is that, yeah, it's very, very slow. So there's lots of like time to integrate while you're doing it. It's definitely the slowest therapy I've ever, and somatic experiencing is very similar. It's just very gentle, very slow. So there's lots of times to integrate and to feel the emotions and to let things move through you. Um, However, also thinking about what she said, I think what I've been doing now a lot with people is when people are coming in for the workshop, I'm screening them a little bit to see if they've had therapy before, if they're able to be in their body, if there's a lot of trauma and somebody's dissociated, and then they're going to come to this. I've, had some people say, oh yeah, like it's a lot. And so I've been screening people a bit more now with the constellations, just for that. Like and the people that it's a lot for, still really benefit for it and love it and often come back. But there is that piece that I really, and that's actually why I'm doing somatic experiencing with people actually in office now, because that's actually helping to prep people before they come and do, a big day. And also, I'm creating a 6-week program right now that's going to just offer a little mini, like a general constellation's about an hour, and the program is just going to offer like little mini 10-15 minute constellations and somatic work and little exercises to get people's feet wet, and get people familiar with that, before jumping in for a full day. Yeah.
Okay. And just for folks who might not be familiar with somatic experiencing, could you just, give us like a, you know, um, elevator pitch on like what that's all about?
Yes. Soma meaning body in Latin, so body in body. Um, Somatic experiencing, again, is it's really everything is tuned into your body. Everything that you say, as soon as you can think a thought, and a somatic experiencing therapist is going to bring you to how that feels in your body. Where do you feel that in your body? Describe how you feel that. And this type of work, because our body doesn't lie, and it holds on to so much, as we know, pain, suffering, trauma. This type of work really gets us, because we're outside, we're often so in our mind. So when we start to really tune in to our body, and we start to realize, like, oh, actually, every time I think this thought, I feel it in my stomach. Every time I think this, my right shoulder actually starts hurting. And so, it's a way of, really tuning in to like very, very slow, tuning in, and the therapist will kind of always just bring you back to, okay, yeah, how does that feel in your body, and exploring that sensation. So with this work, when you start, somatic experiencing is in body, but it's also, a lot of times people, when you're doing that work, they'll start seeing visions and colors, and so the therapist will guide them to, what they're feeling, what they're emoting, and really just kind of going down this exploration of right brain, look at, how they're feeling in their body. So this could be an example, even with somatic experiencing with somebody with chronic illness. If you're mentioning Lyme, even just like saying it, like I have Lyme, and then what are you feeling in your body when that happens? And then exploring, oftentimes what happens is that will just lead in a whole cascade of other sensations and emotions and things that get brought up that can also just vary, in my experience of it. And in the short time I've been, I'm into my second year of somatic experiencing. In my short time of doing it, it's just blows me away, because every time I do it, I'm like, oh, I all of a sudden have a vision or an insight or just more depth to whatever the topic was that I was bringing up.
And for both the family constellation therapy and somatic experiencing, if I remember correctly, you said you use the word slow to describe both of those processes. And um, I don't know, one part of my brain, I'm going to say my left brain is kind of like we need results fast. People are suffering. We need to like get them feeling better, lickety split. And then so part of me is wondering if you could expand on slow in that, like, well, how long are we taking here? Like, is this like really slow, or is it more like, no, it's like slow and gentle, but like, and that it's not super intense. And then, actually, yeah, maybe I'll just leave it there. So yeah, could you speak to the slowness, side of things?
Yeah, in fact, I think part of it is just it's when that nervous system gets so tight and twisted, and so when you start to do this kind of work, it's, to unravel it, if you do it too quickly, a lot of times what happens is the person can't fully integrate that. So what you want to do is to be able to integrate it not only like mentally and emotionally, but somatically. So when you're doing it, slowness, and I also think another word is just like quiet. So there's a lot of often silence that just allows the person to kind of dive in terms of like, looking at how many times you would do something. I mean, you can have a significant shift in like an hour, right? Working with a therapist or doing a constellation. So in terms of that, it's quite quick, but there's a quietness and an allowing of an unfoldment of the nervous system. And so for somebody's nervous system that's like really wound tight, and there's always multiple factors as to why that is, but some people have more factors than others. And so with that unfoldment comes this slowness that you're allowing, like as one piece moves and there's an aha, you want to allow enough time, whether that's like just even a minute of watching the body and the nervous system regulate. You're really looking at this window of tolerance, and depending on when our nervous system goes outside of that window of tolerance, we're not going to be, we kind of, that's when we dissociate and we're not able to like fully ground that in our being. So if we stay in the window of tolerance, some people have a large window of tolerance and some people don't. And so in terms of how long you do these therapies for, I mean, it can take time, right? Because you're kind of trying to increase that window of tolerance, and it does increase over time so that the person can tolerate more and more stress, especially people with chronic illness, because they've already have that factor there. And oftentimes their window of tolerances are very small.
So if I'm paraphrasing well or sort of extrapolating from that well, so like it's slow in that, it's kind of moving at whatever pace the patient's nervous system will keep it there. Maybe there's other non-physical levels as well there, but say, it's kind of keeping pace with what the patient's nervous system can tolerate. And so that might go faster for some, slower for some, depending on what's happening. Um, is that fair to summarize it that way? And then just in terms of say like the number of sessions that someone might need to work with to get to the point where like, oh, I'm, noticing some change. Like, is it quite common that a patient would notice some type of change like after every session, or would it sometimes take, 3 or 4 sessions before there'd be, some kind of an obvious shift that they're experiencing?
Great question. Great question. Bert Hellinger, the originator of family constellations work, would say, and I'm saying this with a smile on my face, you only ever need one constellation.
And
um, you
confident
know,
guy.
Pardon?
He was a confident guy.
Confident guy, yeah. I'm definitely not Bert Hellinger. But there are a variety of facilitators that, would say, oh, it's okay to come every month. Oh, you should do it and really integrate the changes and, do it quarterly or once a year. And so there's, after listening, I just finished last year international training, so there was about 40 facilitators from all over the world, and so really getting like an idea of how people were facilitating and like the ideas people had behind it. And I really think it's that drive of just like, okay, if somebody's nervous system is capable of handling it, and there's a want or a desire to really do it, then I think doing it, once a month or quarterly is okay for that individual. In terms of how much you need, I it's really hard to say. I've seen people where they've done one constellation and then I've talked to them later and they're like, that changed my life. Like it changed everything. And then I have other people that, one person thinking of a really tough relationship with money and tough relationship with father. And we did a constellation on a relationship with her father, and it really, really shifted things for her. However, yeah, and it did with money too, but then a whole other thing came into play that we did one on money. And so Yeah, it really depends, but definitely I've seen that you can do like a day of constellations and have a profound shift. So it really depends on, the individual, like what they want to shift and what's happening in their lives. And yeah.
Okay, thank you. It's a good answer. Um, Kind of just in where this is, rapidly turning into like the family constellation episode of the podcast, which is fine. We're just taking it where it goes. It's all good. So just kind of circling back to just the where you mentioned about kind of ancestral things that we're maybe carrying like from our ancestors or whatnot. The rat study. It's super compelling information, obviously. And so just, for a listener being like, this all sounds good, but like, man, like if we just come back to that, like, what's the mechanism of action here? Like that seems like it's a little bit of a leap of faith to be like, yeah, we're carrying stuff for our ancestors. Like, sure, rats, but rats are rats, humans are humans, bells are bells, so I've heard Dr. Klinghardt, and this was quite a long time ago that I did his family constellation, seminars or whatnot. But I believe that he, spun a pretty good yarn about being able to piece together some evidence where there's some sort of we carry some of the emotional traumas and things like that, like actually in our DNA, and that it's something that's like literally passed on. It's kind of like somehow encoded in the DNA, and whether that's through um, certain propensities for certain gene expressions, or it's actually causing mutations, or I don't know, but that he kind of linked it back to saying like there's a plausible physical mechanism here through DNA transfer. Then another plausible mechanism, to my mind at least, would be like, well, maybe it's more about that, so my great grandfather had a certain trauma, and then that caused him to act a certain way. So he raised my, great grandfather a certain way, and then that impacted him. And then he raised, my grandfather a certain way, and then my father, and then me. And then so like it's kind of passing on more through, sort of behavioral choices and changes and things like that. So sounds like there's, we'll say some theory out there that like maybe it's more of like a physical transmission from generation to generation, or maybe it's more of a behavioral transmission from generation to generation. So is there a definite mechanism that you can tell us about? If not, is there another explanation beyond what I mentioned? What are your thoughts on it? You could give us some insight on that, please.
Yes, that isn't that the question of family constellations?
Isn't it?
Yeah, that's the big question. It's like, how does this actually work? So there's a lot of different theories, and yeah, Klinghardt does touch on that. Even thinking of how our eggs are actually in that we come from, we're in our grandmother's womb, and then so it's just the how that whatever our grandmother faced, gets passed to our mother, gets passed to us, our maternal grandmother, obviously. So I think there definitely is on a larger scale. What you mentioned, I think all of that is relevant. I think behavioral patterns, DNA shifts. Like I do think there is that all of that is part of it. The one thing that gets mentioned a lot is just the morphogenic field, the fields that we live in, and how that implements so many, well, everything that essentially it's like this information field that we're a part of. And so we have this family field. So Rupert Sheldrake talks about that, the morphogenic field. And Lynn McTaggart wrote a book called The Field. And so really just kind of getting into, what I have a lot of curiosity about this because doing this work, I've always naturally been quite a skeptic, and it's very funny that now here I am doing constellation work, which is like pretty, it's like how does this work? This is pretty skeptic, but there's such curiosity I have around the field because when you see what happens, in a workshop and you see how somebody responds in the same way that somebody's grandmother would, or information comes in that there's no way that you would have known about that. It's just very mind-blowing. And Klinghardt talks about those 5 levels of healing: the physical, the energy, the mental, the intuitive, the spiritual, and classifies family constellation up there in that realm of intuitive, esoteric. And it really does go there. And I think that's one of the things for me in terms of my practice. It's like the beginning, kind of going back to other things, but working on the physical and making sure people are doing like herbs and the supplements and the exercise and breathing and nature and all of that stuff, and kind of working up the line. And then watching and seeing, okay, if people are getting these things in, it's like Maslow's hierarchy of needs. It's like, okay, if these basic things are met, then can we tap into whatever this is, the intuition or this other part of us that I think is becoming, more and more popular and becoming addressed more in medicine in different ways. But family constellation work is just a way of doing that. Um, and the field is something that fascinates me. It's definitely mysterious, but it holds, I can clearly tell that it holds information. Like, it's very obvious in every workshop. So whether or not, Lynn McTaggart's work, she has some studies in there, and actually it's quite a heavy book to read on the field, but it's interesting. Um, yeah, it's just there's so many different theories of it, but I think the mystery and the curiosity I have is the biggest part that actually drives me to do it more. It's like, what is this? And how is this helping people?
It's important to explore those areas that we can't fully explain, as it's like, ibuprofen, it generally works well for headaches and aches and pains. And it's like, great, like that's been pretty well established, but that's not very exciting to like study that further. It's like, it's just been established. We know what ibuprofen does. But then something like this, like, oh, so much mystery. And yeah, somebody's got to be, thinking about it, looking into this stuff. I have not made my way through the field. I think I picked it up a couple of times. I think my wife read through it. She's much more stoic than me, but it is a very heavy book. But for folks who are not quite ready to go out and read the field, I mean, by all means, go out and read the field. But if memory serves, there's like kind of proposed mechanisms that would kind of start tapping into like quantum physics and things like that, kind of helping to explain some of these phenomena that we don't really have a definite explanation for. So just if folks listening are like, oh, like morphogenic field, like that sounds interesting, but like also very abstract. It's like there is a kind of a science-based mechanism behind this. It's not just like completely just theoretical, more airy fairy. Nothing against the airy fairy. I'm a big fan of the airy fairy, but there is like kind of a scientific mechanism that at least could plausibly explain what's going on. Is that a fair, very rudimentary synopsis?
Definitely, yeah. Quantum physics, I think, does play a role, and I think another part to add to it is that there's just something about even group, and I kind of tapped on it earlier, um, but there's I think it's Francis Weller who talks about how grief and suffering and trauma and pain need to be witnessed, need to be seen, need to be heard. And so, on some level, I think there's so many mechanisms of this work, and it's actually why I even prefer doing group over one-on-one, because just the witnessing of something, people seeing, what you're holding, I think just even that is just something that is a big driving force in change and in healing.
That makes a lot of sense. Um, and actually, it's a great segue into another question I had for you here about the family constellation therapy. So, you've kind of touched on this a little bit, but um, so to my understanding, family constellation therapy could be done obviously in a group setting, which is perhaps preferred. Um, then you can do one-on-one family constellation therapy. I'm assuming you can do like online or distance family constellation therapy, I suppose with video technology or even over the phone. Is that true? And are there other ways of doing family constellation therapy outside of group one-on-one in person or virtually?
I think you tapped on all of them. Yeah, yeah, virtually, in office, one-on-one, and with a group. That's, I mean, you can also learn to do it yourself. So, but
Right,
yes,
right.
that's yeah.
Of course. Yeah. Fringe benefit of doing all the training you've done. It's like, oh, I can just constellate myself, whenever.
Well, I actually teach people that in office little exercises they can do at home, to help kind of get into their body and connect with whether it's ancestors, whether it's with their illness, whatever it is, and even that can provide some profound insight for them.
Great. Well, I know we don't have a ton of time left, Dr. Wilcox. I would like to ask you about a couple of non-family constellation things just to keep it a little bit novel. That being said, though, where this has officially turned into the family constellation therapy episode, are there any additional things you'd like to mention about family constellation therapy, or we've covered some of the major points?
I think we've covered the major points. Yes, I could talk about it forever, but we'll leave it there.
Okay, great. Well, thanks for all the insight on that. I guess just circling back to things that can be done to help support the nervous system, maybe just swinging the pendulum in the opposite direction, like, in terms of therapeutic interventions, like say supplements or medications, or say mental, emotional, mind-body techniques. What are some other things that you find to be helpful for supporting nervous system regulation?
Yeah, I gravitate a lot to herbs, adaptogenic herbs, herbs that are just going to help the nervous system regulate better. I think of it more as, you have kind of two types of your adaptogenic herbs, those herbs that are filling your gas tank to give you the energy to do what you need to do to survive your day, however busy it is. And then you also have these herbs that are calming. They're also known as like alpha sympatholytic, these herbs that are just calming the nervous system. And so oftentimes the two combined, or one or the other, depending on the state of somebody's nervous system and where they're at. I will, yeah, use a combination of herbs for them. In terms of
Sorry, Dr. Lucas, just before you go on, would you mind just naming some of those herbs? Like, we won't get into dosages or anything like that because we're not giving medical advice, but would you mind just giving some examples of some of your favorites, please?
yeah, I mean, one of the most popular I've been, the past like 2 years, I think, patients often come in and they're on like, there's like a general sort of maintenance that people are often on. It's like, probiotic, vitamin D, omega fish oil, like the typical ones. And then often lately I'm finding people are just coming in and they're already on ashwagandha, which is such a lovely herb. And so, but that is one herb that I do love to prescribe because it's, just one that can really, really help drive your sleep to go a lot deeper. And then just also during the day, just to help sustain like endurance and stamina and that type of thing. So I love that herb. I use rhodiola a fair bit, more, if I can say, more for people to have, yeah, vitality and energy. I find that one's a really, really good one to sort of fill the gas tank to allow you to drive further during the day. I use Siberian ginseng a lot, milky oat seed, Schisandra. And sometimes, depending on the alpha sympatholytics, the calming ones, it really depends on the case, but I also love using essential oils as, a mix that you can ingest as well. Uh, Lavender and bergamot, petite grains, another one, um, lemons, another one to use. So just, yeah, different combinations that will help kind of just relax the nervous system. They're not the full answer, but they're, part of the picture that can help somebody to just support their vitality.
And maybe on that note, Dr. Wilcox, where as you said, sorry, I'm paraphrasing here, but like, it's not, the answer, or not like, the be all, not everything they need, but it can kind of support them along the way. So, generally speaking, would you see those types of, adaptogenic herbs or alpha sympatholytic herbs, helping a person, like say if they're, really stressed, they're, really tired because they're, presumably they're, just running in high sympathetic mode and they're just kind of burning through their energy stores, their adrenals, or, really been through the ringer and whatnot. So they're feeling like, pretty stressed, pretty tired, pretty burnt out, maybe brain foggy. Would you generally see those adaptogenic herbs or alpha sympatholytics, helping someone, if say their symptoms are 10 out of 10, we're trying to get them down to like 1 or 0 out of 10. Would you see them, those herbs, dropping someone by like, 1 or 2 points on that scale, 4 or 5 points on that scale? Like, how supportive do you find that they can be? Bearing in mind that, we probably do need to get to the root cause, whether it's more work-life balance, or they need to start exercising, or need to do some stress management, or need to do some family constellation therapy. But how helpful do you find those herbal interventions to be?
Right. I'm going to give you an answer that is pretty typical, I think, for naturopathic medicine. It depends. Uh,
That one. Yes.
but yeah, so it depends, but definitely, uh, it's actually interesting because I actually had a patient yesterday where this was the case. This is an example of something that's happened quite a few times. But yeah, over the holidays, they ended up not doing part of the protocol that we had prescribed, and they only did the adaptogenic herbs. And they had come in for chronic pain, and I wasn't really giving them those herbs for pain. And then they came back in, and they were like, "Oh, actually, like my pain's a lot better." And I was like, "Oh," and they ended up not taking anything else. And I was like, "That's very interesting." And obviously, variables of seeing family and being off and things like that over the holidays also impacted with there's usually more stress around the holidays too for people. But I can see adaptogenic herbs helping people depending on the case. So it's not everything. I've seen it probably 75% in some cases 5%. Again, I think it really depends on uh, a lot of compounding factors, but sometimes it can be that piece that, is not, we weren't addressing at first because we were addressing inflammation or whatever, all these other factors. And then it's like, well, let's add this in and see. And it can just be a make or break for some people.
Yeah. Yeah, it's been my experience too. Like, yeah, some people it's magic and some it's, barely makes a dent. And like I would say on average, like maybe like a 20 to 30%, support if they're not doing other stuff. Like for the patients where they're doing all the other things, but like life's just kind of busy because they've got, too many kids and too many patients and I don't know anybody like that, but that extra like adaptogenic support can be like, oh yeah, that took me from like being 70 80% good to like 90 to 100% good. And so like it just, yeah, it depends on the setting of course, but thank you for sharing those numbers. um just where again we don't have a ton of time left, but I'd still like to pick your brain a little bit more. Are there any non-herbal supplemental interventions that you find to be helpful for nervous system regulation?
If somebody, what I've been doing a lot the last number of years, which is kind of in one way, the opposite of family constellations, I actually do procaine injections. And I find, I mean, while procaine does help regulate the nervous system, it takes you out of that fight or flight state. And for my patients that are just very much like a lot of kids, really stressed, chronic illness, whatever it is, we'll add on some injections during our appointment time. And it's been, if you're going to ask me the question of like, how helpful is that for my patients that it's where they've got a heavy load in all aspects of their life. It's something that does help to keep them floating, if you will, above the water. And I would probably say that it would add another 25 to 30% of a benefit. Um, it's really, really, really helpful for calming in the moment and can often last kind of weeks at a time. I have patients that generally when they get it done, it's every couple of months sometimes, or once a month, or but it can make a big difference in the nervous system. Other aspects like just sleeping more, right? Like having, whether it's herbs for sleep or magnesium, I think is our like most prescribed mineral ever.
Definitely.
Um, yeah. Just working on the nervous system from an orthomolecular point of view. Even sometimes like B vitamins can be just like the, oh yeah, of course, like, so that just feeds everything. So, and even a big piece of with the nervous system is I really focus on the liver a lot, actually, which is kind of maybe a funny thing. I think of it in Chinese medicine, just as where that qi gets stagnated. So that was, I think, the number one diagnosis when we were in school was like, oh, who has liver qi stagnation? And it was, and I see that a lot in patients. And if you can get that flow moving, if a liver, think of it like liver qi stagnation is just like congestion of the liver. If you can really get that moving, people often have a lot more mental clarity. It really helps with brain fog. It really helps like balance hormones and stress. And so it's a whole other aspect that really can benefit the nervous system. And when that's functioning better, just as when digestion is functioning better, that's going to help people drop into a deeper sleep and support their nervous system.
It's almost like that core tenet of naturopathic medicine of treat the whole person is important because if there is I just look at it as, what are all the burdens that are on a patient's nervous system and to say nothing of all the mental emotional factors. It's like, oh, if there's, if the person has like some mild IBS and they've got some mild eczema and they've got, some recurring urinary tract infections, it's like, oh yeah, like I can deal with all that stuff, but it's just like more stuff piling on that nervous system. So if we can get the physical body as healthy as possible, then that's really good for the nervous system regulation too. Um, Dr. Wilcox, thank you so much for chatting with me today. Just before we wrap things up today, were there any parting thoughts that you wanted to share? You've shared a lot, but I just, in case you were like, oh yeah, there's one more thing that I wanted to say. I feel like it's been a really good chat, but anything else that you'd like to share with listeners?
Um, yeah, I think when you're looking at complex chronic illness, there's there's such a weight to that in all the aspects of your life. And touching on it, it's like, yes, like everything is there. And I think I can't speak for you, but what I do, and I think what a lot of us do, is sort of just look, we're looking at the whole picture and seeing what's feasible for somebody to do right now. And family constellations isn't something I'm going to recommend to everybody. Just as injections is something that a lot of people would be like, what? So really kind of just looking, meeting somebody where they're at, and knowing that, I think, in our chart, we always have future plan, and it's like future plan can go on forever, really, because there's just so many options that are there for people, which is something that I love about our medicine. But yeah, it's just that meeting somebody where they're at and knowing that there's many places that you can go, there's many levels that you can go, and even just knowing that, be helping to kind of triage people into the best place to start, is I think really key to it all. Yeah, yeah.
Yeah, I think that's a really important point. And yeah, one of the many things I love about the medicine we practice, whether you want to call it naturopathic medicine, functional medicine, integrative medicine, like just, when you look at some of the algorithms and say more of like just a conventional medical model, it's like, oh, patient has this symptom, do this test from there, go to here, do this intervention. If that doesn't work, go here. If that doesn't work, go here. Eventually, like the algorithm ends. It seems like with the functional medicine algorithm, like especially if you start getting into the higher level stuff, it can never end. And not to say that we want to all be on endless treatment protocols. I mean, maybe you and I do because we're always experimenting on ourselves and our family members and everything to, we want to see what things are like for experienced treatments and methods so we can better explain them to our patients and all of that. But at the end of the day, I think it's really encouraging if a person is suffering from complex chronic illness, or maybe it's not even complex chronic illness, it's just a really, persistent symptom that, is just maybe one thing, but like nobody's been able to find an answer. It's really encouraging to know there are, so many things that we can explore because the human body is so darn complex. And, it's nice to have those options if folks, want to look for them. So I think it's a heartening thing to know about. Dr. Wilcox, if folks wanted to work with you, I know you don't have a social media presence as it stands right now. We've talked and joked about that for many moons now, and that's all good. Probably better to not be on social media, but many of us have taken the bait. But if folks wanted to work with you, either one-on-one or long distance or whatnot, what's the best way to get in touch with you?
The best way is to go to our clinic website, East Coast Naturopathic.
.com.
.com. Yes,
Doesn't
yeah.
even know the URL because you're just not worried about promoting
Okay,
it.
that's true.
Wonderful.
.com.
I'm just teasing there. So I'll include the link to our website in the show notes below. And yeah, thanks so much for taking the time to chat with me today. I really enjoyed it.
Yes, thank you. Same.
And thank you to everyone who listened to this episode of the Overcoming Chronic Illness podcast. I hope that you enjoyed it, and please stay tuned for the next one.